Absolutely. I think, I founded Geneoscopy about 10 years ago with the idea that we could build a non-invasive diagnostic test for individuals who require colorectal cancer screening. About a year ago, we received FDA approval for that product, ColoSense. And to be a year removed from that approval process, it feels so great to already start seeing that test be included in guideline recommendations by clinicians, by the people that I built this test for, to serve the population that truly needs more options for colorectal cancer screening. So it's really an honor to just see all that progress that has been made over the last couple of years to start integrating that test into guidelines and into clinical practice. Yeah, so there's a number of options for colorectal cancer screening for average risk individuals. Traditionally, colonoscopy has been the gold standard for colorectal cancer screening since its implementation in the 70s. What we've seen is that many patients are not compliant with colonoscopy, and so as such, a lot of non-invasive options have started to be developed and implemented in clinical practice. The first of those options was the fecal immunochemical test, which requires swabbing stool samples to assess for hemoglobin. And then more recently, molecular options have become available. The biggest benefit for ColoSense is that we're a non-invasive option. It's incredibly easy for patients to complete our test at home, again, non-invasively. And we also provide a really high accuracy profile specifically for individuals who are under the age of 55. We know that colorectal cancer incidence is on the rise in young patients, and it's actually one of the leading cause of death for both men and women under the age of 50 for cancer-related deaths. And so we built this test really to service all patients who need colorectal cancer screening, but we kept in mind and we're very cautious about making sure that this test was accurate in that younger patient population. And that's one of the biggest benefits of ColoSense. I think, clinical trial execution has evolved, in the face of the pandemic, in the face of changes of how we consume healthcare and how we engage with healthcare. And in light of AI and all these resources at our fingertips, the patient population is different now. And so at Geneoscopy, we've again been very cognizant of that and made sure that we're designing and executing clinical trials with the patient in mind. So traditionally, clinical trials enroll through sites. They set up sites at endoscopy centers and they enroll patients using clinicians and nurses at these sites. And what we did was we leveraged a decentralized recruitment model to enroll patients where they are. Online, on social media, at home, individuals who may not have access to healthcare, who do not actively engage in healthcare. We were able to recruit patients who are not undergoing colorectal cancer screening by using ads online, by using social media. And so that was one of the ways in which we improved on our recruitment model and we engaged with individuals who, again, were not actively participating in colorectal cancer screening. What we saw in the CRC Prevent clinical trial was that more than 60% of patients had never before been screened with any screening modality. And not only were we able to get those patients to complete a ColoSense test, but we were also able to navigate those patients to colonoscopy. And so as we move towards commercialization, one of our biggest ideas about providing care to our patients is navigating patients to colonoscopy if they've had a positive non-invasive test. I think, I'm a clinician. I built this test for patients, but I built this test recognizing how clinicians operate. You know, they're busy. They very much care about their patients and they want the best tests for their patients and they want the best comprehensive care for their patients. Um, but maybe that burden is not necessarily always on the physician. I think when we built ColoSense, we envisioned comprehensive care for the entire screening requirement for that patient. So it's not just get them a ColoSense test at their door after a prescription. It's follow up and make sure that they get that test returned to the laboratory. It's assessing if that patient needs to be navigated to a colonoscopy. It's making sure that if a patient had a negative non-invasive test, that we're reaching out to them 3 years later and saying, you're up for a subsequent screening. We'd be happy to send you a test. You need another prescription. So it's just being cognizant that, it's not a cross-sectional data point to provide them with a single test at a single time point. Individuals need comprehensive care throughout the lifetime that they require screening and making sure that we're getting the right patients, non-invasive testing for only average risk individuals, not patients that have IBD, not patients that have a family history. So I think we've been really cognizant of some of the problems that colorectal cancer screening has traditionally in terms of making sure that patients are compliant, making sure that they're being followed up, and making sure that they're actually getting to colonoscopy if they need one. And I think the hope is that clinicians recognize the effort that we've put into the patient's journey, and feeling like we are taking care of their patients, even kind of in the background and making sure that all of that is being done and that the burden is on Geneoscopy to have that appropriate level of care. Yeah, I think, we don't view ourselves as a single platform. There's a number of different disease indications that we're pursuing and different applications of non-invasive stool testing that we're pursuing to ensure that we can build non-invasive diagnostic tests that help better monitor, treat, and diagnose gastrointestinal disease. Well, I think our initial test has been in the oncology vertical. I think there's a number of other indications that we can address that are either an inflammatory or autoimmune or infectious, that we hope to explore. But to your point, we also did see some cross-reactivity with pancreatic cancer or with prostate cancer or other GI conditions. And so our research team is definitely pursuing those avenues and trying to see if we can expand the profile to include other GI cancers that we might be able to detect early, and intervene early. Yeah, the guideline situation is kind of up in the air right now. I think everybody's, aware of what's going on with the USPSTF, with various other guidelines, the fact that we're in, an administration change and that there's a lot of things that we don't know. But what I would say is that colorectal cancer screening innovation has exploded in the last 2, 3 years. We now have 3 novel tests that have been FDA approved, and all 3 of those tests are going through evaluation with the guidelines. I'd say that having ColoSense included in the NCCN guidelines, which is the standard of care for, cancer screening, is, a huge win for patients and providers in terms of gaining access to these tests that are so important for preventative care. And our hope is that will also be included in other guidelines in the near future, including the American Cancer Society and USPSTF.